Dear friends, it is really a pleasure to be in the same hotel, same building as we were in 1998. It's 12 years, and I see a few faces here in the room who were actually at the same meeting. It's easy to get an idea, but to pursue an idea over a long period and keep with it is a little bit more difficult. And I'm extremely grateful for those who have been with me or us over the period. I would also like to mention, in these times when you hear bruises in the TV and radio about differences between people in the world, that normally, coming from a Jewish family or from a Muslim family, this is the weekend where you spend time with your family. And in this room we have several from both groups actually, and this is something where we in the medical family never ever have any views on this. But this weekend and today it's Ramadan Karim, which is the most important day in the Muslim world. And so they have left their family and come here, to spend it with us, the BDD family. And yesterday and today, it's the Jewish New Year, which is Rosh Hashanah, which also I think is very important. And even some of the members here, they went actually to Malmö yesterday to celebrate that. Again, 10 years has passed relatively quickly. The Bone and Joint Decade 2000 was initiated here in Lund, and it's too soon now coming into its final year. A lot has been achieved, but much remains to be done. In a number of countries, musculoskeletal conditions has gained public and political priority. Non-communicable diseases are slowly moving up now on the agenda in regional and global organizations such as US, NIH, European Union, WHO, UN, etc. But Bone and Joint Decade still lacks attention. The 2010 annual report tries to capture this and exemplify some of the national and global achievements throughout this full decade. From the start, it was decided to organize an annual global network meeting, and as Christina said, this is the 10th. Each year in different parts of the world to exchange information and learn from each other, to understand disparities, and most importantly to enhance and support local network activity. In 2010 we are thus back here in Lund. Your personal involvement and devotion to our mission of improving musculoskeletal health and your generosity with your time have been of immeasurable value. This and the friendship we have created in the Bone and Joint Decade family are really unique. I would like to mention some of the steps which we have seen as instrumental in the success of the decade. The creation of the National Action Networks, bringing doctors, academics, the patients and the policymakers together at the same table to agree and act on priorities, was done from the start, and for the first time actually through the Bone and Joint Decade. This solid partnership will also be the key to future progress in national, regional and global musculoskeletal forum. It is by working together, as Armin Kuder has said, we create a tide that lifts all boats. Raising social awareness by publishing national and global data on the enormous burden of musculoskeletal diseases, and repeatedly explaining that quality of life is not only adding years to life, but life to years, that has been central to the Bone and Joint Decade focus. Yesterday we had 4 severely handicapped Japanese bicyclists that have for the last 5 years been biking all around the world. They arrived here in Lund, amputated, severe handicap. They have been gone through South America, Africa, North America, and they were arriving here at 3 o'clock yesterday, showing that what it really matters is that you are adding quality to life. They show that they went around, to show that you can improve trauma care, and you should improve trauma care. The Bone and Joint branding of the term musculoskeletal science has led to numerous musculoskeletal university coalition departments being formed, and also including epidemiology, basic research, inflammatory conditions, matrix and bone biology, genetics, bioinformatics in their program. This gives, I would say, enormous hope for future progress in research as well as prevention and multidisciplinary treatment. The BDD has also from the start been engaging in the directors of the major global organizations to raise awareness about the burden of musculoskeletal conditions, in particular the epidemic of injury and disability caused by road traffic accidents. These concerted efforts has led to major, significantly funded UN programs and declaration with significant budgets, lastly by Bloomberg, about $125 million to the program. This has been initiated by the Bone and Joint Decade. Recently, a global program for improving trauma care was also initiated in Brazil by the WHO, again based on our initiative. Bone and Joint Decade conditions are not going to disappear. In parts of the world where our population are growing older, the age quake is increasing, the burden of musculoskeletal disease exponentially rises. Meanwhile, in the developing countries, arthritis, spinal disorders, osteoporosis, and childhood musculoskeletal conditions, and particular trauma injuries, will lead to major disability and invalidity and create significant costs to the healthcare system and further choke the efforts for developing an economy to rise out of poverty. The task is not yet complete. The decision at the network meeting in 2009 in Washington, moving forward together in 2010 to 2020 with adopted bylaws and a newly elected International Coordinating Council supporting the national networks and governmental priorities, is important for ongoing coordinated action and progress. On behalf of the BDD family, I thank you for your support over the years, and I wish you all good and hope that a brisk breeze blows for the BDD Armada. Thank you. And I would also like you to raise up for a short minute, because one of our steering committee members, Ted Harris, passed away, and if you could stand up with me for a short period. Thank you.